Hey, future RN, sinus bradycardia is one of those ECG rhythms that is tested all the time on the NCLEX, especially in your med-surg, cardiac, and priority questions. So today, we are going to break it all down: what it is, the causes, the signs, what you need to do first, and the treatment, so you can walk into your exam and answer these questions with total confidence. Welcome to ClearPath NCLEX.
You know, this rhythm really is an NCLEX favorite, but the good news is it's super predictable. Once you know what to look for, you've got it. So let's break it down together, step by step. You can absolutely master this. Okay, so first things first, let's build our foundation. We're going to start with the absolute basics. What exactly is sinus bradycardia, and what does it look like on an ECG? So in the simplest terms, sinus bradycardia is just a normal heart rhythm that's moving in slow motion. The magic number you have to remember is 60, a heart rate less than 60 beats per minute. Now that word sinus is key. It tells you the electrical signal is starting in the right place, the SA node. So the problem isn't where the signal comes from, it's just how slow it's going. Now, when you look at an ECG strip, this is what's so important. Everything, and I mean everything, is going to look perfectly normal except for that slow rate. The rhythm, totally regular. You've got a P wave right before every single QRS. And the PR interval and the QRS complex, both are completely within normal limits. The one and only giveaway is that rate, clocking in under 60.
Okay, so you've spotted the rhythm. Awesome. But the NCLEX isn't going to stop there, right? They're going to ask you why it's happening. So let's get into the most common high-yield causes you absolutely have to know.
All right, this slide is a big deal for NCLEX questions, so really focus in here. Sometimes a slow heart rate is totally normal, like in a highly trained athlete whose heart is just really efficient. It can also be triggered by something called vagal stimulation, like when a patient is bearing down. But here's the one you'll see a lot: medications. Beta blockers, calcium channel blockers, and especially digoxin are huge culprits, so always check your patient's med list. Then you have more serious causes like hypothyroidism, increased pressure in the brain, or even a heart attack that damages the heart's natural pacemaker. Okay, this next part is absolutely crucial for any priority questions you get. See, a slow heart rate can either be no big deal or a massive emergency. And your job as the nurse is to figure out which it is by looking at your patient. So think of it like this. You have two buckets: stable or unstable. If your patient is stable, they're asymptomatic, they feel totally fine. Your priority there, just monitor them and investigate the cause. But an unstable patient, that is a whole different ballgame. They are symptomatic. They're going to feel dizzy, maybe even faint, or act confused because their brain isn't getting enough oxygen. That requires you to intervene and fast. Remember the golden rule. You always assess your patient, not just the number on the monitor. All right, so picture this. Your patient has a slow heart rate, and they're telling you they feel dizzy. What do you do first? This is exactly where the NCLEX tests your critical thinking. It's all about knowing how to prioritize to keep your patient safe. Here are your steps, in this exact order. Number 1, assess the patient. Always start here. Check their airway, breathing, circulation. Get a full set of vitals. See how they're acting. Are they confused? Are they complaining of chest pain? Step 2, based on that assessment, you determine if they're stable or unstable. And that decision leads you to step 3. You act. If they are unstable and symptomatic, you call for help, like a rapid response team, and you get ready to intervene right away. Okay, let's wrap this all up. We're going to talk about the go-to treatment and then pull everything we've covered into a final cheat sheet. This is the stuff you absolutely need to have locked in for exam day. So, for that unstable, symptomatic patient, there is one medication that you must know for the NCLEX. The first-line drug is atropine. It's given IV, and what it does is it blocks the nerve that's telling the heart to slow down. Basically, it tells the heart's pacemaker, hey, speed up. This helps to raise the heart rate and get more blood flowing where it needs to go. And here it is, your cheat sheet. Screenshot this, write it down, whatever you need to do. Sinus bradycardia, a heart rate less than 60. The key causes to remember: athletes, beta blockers, and digoxin. The worry signs: dizziness, fainting, and low blood pressure. If you see those signs, what's your priority med? Atropine. And the number 1 golden rule: always assess your patient first. And really, that's the bottom line. If you can master the symptoms and know the priority action, you will absolutely crush these questions on the NCLEX. Thanks so much for watching this explainer from ClearPath NCLEX. If this helped you, go ahead and give it a like and subscribe for more high-yield content. And hey, drop a comment below. Which cause of bradycardia do you always remember? I read every single one. You are doing amazing work. Keep studying. You've